Hello, everyone. It is a pleasure to be with you today. My name is Diego Morabello. I am consultant for LAC Platform. Today, we will be talking about the support of the Global Fund is providing to grant recipient countries to deal with the COVID-19 pandemic. For this, we have two analysts here, who will be telling us more about the financing mechanism. But first, I want to tell you that the questions or comments you have can be sent via chat to be answered at the end of the session. I want to introduce to Annalise. She is a public health and international development professional with over 28 years of experience focused on HIV, tuberculosis, and malaria, with a special focus on the Latin American and Caribbean region, as well as Southeast Asia. At the beginning of her career, she worked in a major NGO in Guatemala, later as head of the country's HIV program, and in the region in public policy development programs. Since 2009, she works at the Global Fund, first as portfolio manager for Latin America and the Caribbean and Southeast Asia. In 2015, she returned to the region as head of the Latin American and Caribbean region. And since April of this year, she has begun a new role within the fund as director of the Department for Europe, Asia, and Latin America and the Caribbean. Welcome, Annalise. We look forward to hearing your presentation. I'm very happy for you joining us today.
Thank you. Good morning to everyone, or good afternoon, depending on what part of the world you're in. I'm going to try to go through a brief presentation with you, and then depending on where we end up at the end of the presentation, please include your questions or your comments, and hopefully we'll try to make this as interactive as possible. So I'm going to share my screen, which hopefully will work. Okay. All right, so we'll start. And I think everybody sees the screen. So I wanted to start by talking a bit about the community engagement and financing mechanisms for COVID-19 responses. And I'll start with a basic introduction. So as you know, the Global Fund has made available up to $1 billion to support countries to respond to COVID-19. And we've done this through two different mechanisms. And I know that it's a bit confusing because these have happened quite quickly, one after the other. And it's part of the way that the Global Fund has been responding on almost on a daily basis to try to make sure that countries are ready and able to continue to deliver on the three diseases and the responses that are required even within the COVID context. So the first one is around fundings being directed through two channels. One is the grant flexibilities, where there's up to 500 million available through grants. And then there's the COVID-19, or the C19 RM for short, that makes available up to 500 million of additional funding, not part of the grants, and this is a question that comes up often, but that is aligned to a percentage of the total allocation that you have assigned to the 2022 allocation. But it doesn't come out of your 2022 allocation. It's additional funding. It's just a mechanism to determine how much money countries can access. So how the countries access these funds differs from the standard Global Fund request or funding request process. And the process also differs between the two distinct funding streams. So if we look at the first one, which we'll go into in my next slide, and then I think the final important message here is that communities and civil society should be aware of these differences to optimize efforts to ensure engagement. Then to talk a bit about the differences that will hopefully help you understand. So if we look at the grant flexibilities, it's not additional funding, it's funding that is coming through the 17-19 allocations, the grants that are active now and running. And you can access up to a maximum of 10% of the total value of the existing grants. That means 5% maximum for from savings, and if all savings have been exhausted, you can also then request 5% of reprogramming of activities that you believe may not happen given the COVID-19 situation. or activities that may be delayed, or activities that you may think are useful to reprogram given the current situation. Countries are encouraged to utilize savings first before seeking reprogramming. And then also clearly, countries are encouraged to use grant flexibilities before applying to C19 RM funds. The mechanism of grant flexibilities is much faster. For those countries that have already applied, they will say that it was quite quick turnaround from the moment that they made the request to the moment that the Global Fund sent out the approval. The requests are submitted by the PR, not the CCM. Although CCM endorsement is encouraged, given the emergency way in which this was sent out, particularly in the beginning, and focused on supporting, making sure that we could get the money out quickly, there is no CCM endorsement required. Secretariat approval time for this has been about 5 working days on average, although we have turned around things in as quickly as 24 hours, depending on how straightforward the requests are. The C19 RM is the new funding that was also approved a couple weeks after the grant flexibilities. And this includes up to 10% of the 2022 allocation, minus any funds already accessed via grant flexibilities. And this is important. So what CCMs will have to do is calculate what has already been accessed through grant flexibilities, so through savings and or reprogrammings. Calculate the 10% of the new additional funding that you have in the total allocation of the 2022 allocation, and whatever the difference is, that is what you can access through the C19 RM. The requests need to be submitted by the CCM and not the PR. Normal CCM eligibility requirements remain in place. Communities and civil society must be engaged in request development. And although we have a suggested deadline of 31st of May, submissions can come in tomorrow if they're ready. So you don't have to wait for the deadline. They should be coming in. We had our first request actually coming in today, not from this region, but I think it is important that you get these in as quickly as possible. And the Secretariat approval time for these is around 10 working days. So there is an actual request submission form that needs to be filled out. So C19 RM does require some additional work that the grant flexibilities does not. And C19 RM, as I said, is additional funding. It's not going to be deducted from your 2022 allocation. Then the status of grant flexibilities, just to give you an update of where we are. As I said, this one was launched in mid-March. To date, we've had 87 requests totaling 129 million of approved and integrated into grants. This is globally. Majority of the funds are coming from savings and not grant reprogrammings, although we do have some grant reprogrammings in this region. The difference in amounts are quite small. The major focus on these specific requests has been on COVID epidemic preparedness around diagnostics, PPE, in the requests submitted. And this is just to give you a snapshot of the requests that have come in for LAC to date. I'm not going to go into the details of each specific country, but just to say that from Latin American Caribbean region, we've had 4.4 million of requests from 13 countries through the flexibilities on savings and reprogrammings. This is as of the 18th of May. Finally, these are some examples of what has been requested. So for example, in El Salvador, they requested mitigating impact on TB programs by purchasing surgical masks, N5 respirators, masks, alcohol gel, and thermometers. In Honduras, they asked for the purchase of 25,000 surgical masks and N95 respirators, and ventilators and mobile X-ray machines. In Cuba, they asked to strengthen the molecular diagnosis of COVID-19 in regional laboratories, purchasing gloves, face shields, masks, gowns, to mitigate the impact on HIV programs. Then Suriname is advancing the procurement of the P-Vivax medicines in anticipation of global rush on goods, as well as the procurement of laboratory supplies to enable and strengthen laboratory diagnosis. We also know that additional requests are coming as we speak from Guyana and Suriname, as well as other countries in the Caribbean. Then the status of C19 RM, as I said, this was launched in late April. All the application and materials and guidance notes are made available, and I'm putting the link here. So after the call, the presentation can be placed online, and you can access all the documentation. But it's also on our webpage under the section of COVID-19 response, and all of the application materials are there. CCMs are encouraged to submit the request by May 31st, as I said, but can submit anytime. I have to update this because no requests, we actually had a request that came in earlier today. So one request has been submitted as of 20th of May, not from this region. But we do expect, based on the projected information we have, that 65 requests will come in before May 31st. And then, as I said, the Secretariat will review and approve within the 10 working days from submission. Community and civil society engagement is required in the development of this particular component. Then I think it's also important to talk about what can be funded, and this is a question that comes up often. And so for both grant flexibilities and C19 RM streams, proposed activities must fall within one of the three categories. Interventions to mitigate the impact of COVID-19 on HIV, TB, and malaria programs, actions to reinforce the response of COVID-19, initiatives to make urgent improvements in health and community systems. All proposed activities must reflect Global Fund and or technical partner guidance. There's lots of guidance out there, so please refer to this when you're thinking about what you're going to request. Minimum human rights standards must be maintained. And I think something that's really important that you need to know is that the C19 RM requests include two priority levels, and you'll see this if you open the application materials. We have priority 1, which is the primary funding request, and priority 2, which is additional funding request. And this is quite important because priority 1, which is up to 3.25% of the 10%, is prioritized because this is where we already have funds available that, if approved, we can fund immediately. Anything that goes into priority 2 will not necessarily be funded immediately, but will go into the priority channel. And as new funds become available to respond to COVID-19, we will be looking at funding further percentages of the priority 2 funding. So priority 1 is what will definitely be funded first, and priority 2 if funds become available. And this is why when we talk about savings and reprogrammings from the first part, the grant flexibilities versus the C19 RM, is that you will have immediate access to a 10% from the flexibilities if what you're requesting makes sense. For this one, you will have, in principle, if approved, priority 1 funding request approved, but priority 2 will go into a cycle of as funds become available. Who can be funded? And this is also quite important. So C19 RM requests must include assigned PRs and SRs for each activity listed. So what this means is we cannot have a specific new principal recipient that will be managing these funds. It has to be managed by the PR that is at present managing the funds in country. If you have more than one PR, you can select one of them to manage the COVID-19 funds for the C19 RM. If it's from the savings and reprogrammings, obviously these would come from the specific grant from which you're requesting, and the PR that manages that grant would be responsible for the implementation of that specific component. So the difference is that, for example, if we pick a country that comes for a C19 RM request and requests the procurement of, let's say, PPE and tests for the 3.25%, they can decide, even if they have 3 different PRs in the country, they could decide that one of the PRs is actually going to add this money to their grant and implement it. You can also ask for each individual PR, if you have 3 different PRs, to take a percentage of that, but it obviously complicates things in terms of putting it into the grant. So think about that when you're deciding what programs will be managing this, and which PR has probably the best capacity to actually either complete the procurements or do what needs to happen to get the goods into country if it's goods, or to be able to support the implementation of whatever it is you're requesting. What if communities and civil society are being excluded? I think this is something important that we've gotten quite a bit of questions on. And I just want to say that you should reach out to your CCM leadership and PRs to get information about where the process is and how you can contribute to bring ideas. I think it's important to mention that there's a difference between not being included or being excluded, and that whatever you're proposing may not be in line with what the Global Fund can or cannot fund. So it is important to have these conversations, to have these discussions, and to make sure that what you're requesting or what you would like to be funded is actually something that is aligned to the 3 areas that I mentioned before. And you can speak to, also get support from partners on the ground, from community representatives, technical partners, UNAIDS, PAHO, and World Food Program, to see what other organizations are doing, because it is important to make sure that you're coordinating the responses with other organizations. If you have any specific questions, please notify also your fund portfolio manager if you have concerns or have exhausted other channels. You can also discuss it with the CCM Hub and also the Community Rights and Gender Department. So there's lots of information out there, and as I share the presentation, you will be able to access a lot of this information. But there's the funding request instructions, which is all in the column to the left. In the middle, there's the Global Fund COVID guidance, which is the information notes on HIV, on malaria, on TB, on RSSH, on human rights, CRG, continuity of core coordinating mechanism responsibilities, and the virtual inclusive dialogue, even for the funding requests that are coming. So there's a lot of guidance out there for you to review and to get further information before you reach out to us at the Secretariat. And then there's a whole component on technical partner guidance, and there's a link here also to the full partner technical guidance. So we've tried to set up all of the links to WHO guidance, UNAIDS guidance, and other partners that have put out guidance. So a lot of documents that can help you prepare for how to best respond to COVID-19. And I think one of the things that I'd just like to end on is the fact that I think it is important to begin sharing best practices of how countries are, finding ways to continue to implement activities and programs across regions. And there are some interesting examples of what's happening, because this is all, for all of us, this is new. How do we continue to make sure that people living with HIV continue to access treatment? What are the implications that we're having in terms of delays in deliveries, and how different countries have found ways to manage these things? So I think that as we move along, one of the lessons learned that we have very shortly into this process is that many organizations on the ground are finding very creative ways to continue to deliver. And so sharing these best experiences and these best practices is something that I hope we can continue to work on together as we move forward in this. And one thing that I also think is quite interesting is that some of the examples that have come up, or some of the things that some organizations are working on, may actually be best practices that we want to keep after, once COVID-19 is no longer, hopefully, affecting our lives the way it is today. So I think some of these best practices may be things that we can actually take on for the future. So I will stop the presentation there and see if there are any questions or comments that you would like for me to respond to.
Thank you so much, Annelies, for this presentation. We have some question for you.
Okay.
First, possible part of this question was answered in your presentation, but it is good to say it again. What percentage of the 1 billion emergency allocation went to Latin America and Caribbean?
So it's a good question, and it's a simple one to respond to. So it depends a lot on your allocations. So each country allocation for 17-19 can access up to 5% of savings and 5% of reprogrammings if there are available. And it's important to understand that in terms of savings and reprogramming, they have to be available within the grants in order to use this flexibility. So that's up to 10% of your grant. And then for the C19 RM, it's up to 10% of your total allocation for the 2022 cycle. So what this means is that if we think of, I'm trying to think if I take the example of Belize allocation for the 2022 cycle is close to 3 million. So we would take 10% of that, and that's what they can request through the C19 RM request. If they've already come and requested money from their 17-19 allocation, it's not a plus. So whatever you've already requested through the savings and reprogrammings, you cannot come and request through the C19 RM. So it's not actually 10% here and 10% in each one. It's 10% maximum across both of the cycles. So this is really important because you'll have to determine how much you had already requested through the flexibilities before you come in through the C19 RM, and your FPMs can help you determine exactly what is still available for you through the C19 RM and what you can come and request for each individual country, depending on how much you've already requested through the reprogrammings and savings.
Perfect.
The multi-country programs can also come in and request fundings from the 17-19 allocations, and some of them have already come in with their requests. So yes.
Okay. What is the process they must follow to submit or adjust their application?
So as I mentioned in the presentation, it really depends on which one they're coming in with. The savings and reprogrammings, they need to find the savings within the grant, and that's why the PR has to submit it, because the principal recipient is the one that has the clear picture of whether there are savings within the grant, and also if there are areas that are definitely not going to be implemented within the grant due to the COVID-19 situation, of where they could also come with reprogrammings. For the C19 RM, as I mentioned, all the application materials are online, and there is a soft deadline to submit of May 31st. I say a soft deadline because, yeah, obviously if you submit in June 5th, we're not going to reject it, but it is emergency funding, so we don't expect C19 RM requests to come in November and still be approving them. The idea is that every country that can access and will access this funding will come on at the latest May 31st or soon after.
Thank you. I want to remember to the people that see us today that you can send your comments or your questions through the chat in the YouTube channel. I have another question, Annelise. How can a person from K populations or from a civil society organization that does not belong to the CCM in your country is a part of the question now whether or not your country is turning to states to support alternatives?
So I think it's important that if the key populations usually have representatives on the CCM, and so they should certainly advocate to that CCM member to make sure that, I mean, the hope is that there have been mechanisms, and I know it becomes difficult with COVID-19, but that they have looked for mechanisms to be able to have chats online or discussions, so that when those discussions happen at the CCM level, that there have been inputs from communities into those discussions that have happened. And I think it is important to mention that when we think of the support that we are providing, the ultimate goal of this C19 RM request is that we can continue to deliver on our results, and that this money will help us find flexibilities to be able to do that. So, for example, if we think of a malaria grant, and if we have a request that comes in to provide PPE to the community workers so that they can distribute the bed nets, continue to distribute bed nets, that would be something that would be a clear way of continuing to achieve our results, and ensuring that the staff that is delivering on these results continues to be protected while they do this. Similarly, if we're thinking of, for example, also providing PPE to community workers that are doing HIV testing, or providing support to strengthen labs so that they can continue to do TB testing as well as COVID-19 testing. These are all things that we would look to support to make sure that we can continue to achieve those results. So it's really about the PRs and the SRs and the CCM sitting together and saying, okay, what is that this program wants to achieve before COVID-19? And are there things that we can continue to deliver on even within the COVID-19 response? So, for example, if we have situations where we were going to do in-person trainings, can we now make them virtual trainings? And what is the implication of that? Does that mean that we need to now procure a subscription to streaming mechanisms like we're doing today so that you can actually continue to do those trainings? Does that mean, so it's really about thinking creatively of what are the things that we need to continue to deliver on our results.
I have another question. The approval of the use of the resource must to be supported by the endorsement of the community representative.
So the request needs to be endorsed and supported by the CCM members. So it's for the C19 RM, and that's important. For the other one, it doesn't have to be endorsed by CCM. So the savings and reprogramming does not. M does. And it, as I mentioned in my presentation, it is required based on our CCM endorsements, similar to what would come with a funding request. So all of them have to endorse it.
Okay, we have another. The deadline to apply to the COVID-19 response mechanism is May 31. Is there a deadline also for the request for reprogramming and the other options that flexibility offers?
So there is no deadline for the reprogramming and the savings, although similarly to the deadline to apply for the COVID-19 response, you should come in as soon as possible, because the message that we've sent to countries is the grant flexibilities are something that countries should be jumping on in order to support the immediate needs, as well as the C19 RM response. So there is a limit to the time in which you have to implement these funds. So it's not, particularly for the C19 RM and the others, you won't be able to implement beyond June 2021. So the idea is that all of this money will go into grants and will be able to be spent quickly into the implementation of the needs that the country has, and not necessarily, the idea is not that this money will now become additional money for the new grants and that you'll have 3 years to implement it. If it's not implemented quickly, there may be a point where that money will be returned, have to be returned to the Global Fund, because it is for the emergency response.
Thank you, Annelise. We have another question. Many people is asking about it's possible that resource can use it for food, for example, or for another utilities.
So this has been a question that has come up quite a lot, and it's a difficult question to respond to, because obviously from a human perspective, we understand that COVID-19 is creating a significant amount of havoc in terms of access to food security, particularly in terms of also because there's no access to labor force, and that's something that is quite critical. And so for us, the message is we're not equipped to provide food sources, and we would have to really be able to justify how the food source or the food support is actually helping us to achieve our results. So I'm not saying 100% no, but there would have to be really clear justification. So we can't just provide food support just because people need food, but it has to be really linked to how we're going to better achieve our targets. And so it's a difficult one. It's something that we have to think about if this is the best mechanism that we can come for these kinds of requests. And in general, we will have a difficult time supporting this. So we'd have to look at it on a single case-by-case basis, but the reality is that it's not something that we would openly fund in every single country and for every single mechanism, and because that's not what we do. And that's one of the things that we've actually discussed quite a lot in terms of what other organizations can we reach out to within the region to try to get some food security and some food support. So, is there a World Food Program available in countries? Are there other mechanisms that have been explored? And this is something that you would have to really share with each of the FPMs in the countries that you work with. And what are the mechanisms that you've reached out to be able to try to provide this support before coming to the Global Fund, and really present a case that would make sense within how we're going to better achieve the targets that we've set out.
Perfect. I don't know, maybe someone have another question. I don't receive more for the moment, but I want to invite to you, Annalise, maybe if you can add also that is important for the people listening us today.
So I mean, I think that the critical component of what we're discussing today is the fact that the Global Fund wants to make sure that we continue to be present, that we continue to be there to support countries in achieving their targets. One thing that we've been hearing a lot in many different fora is what is the impact that COVID-19 will have on the achievement of our results, and where will we be at the other side? And several studies have been commissioned around what is the impact on TB or malaria or HIV results, given the COVID-19 situation in many regions, and also the economic situation of where we may be at the other side of this. So I think that it's quite critical that we understand, and one of the concerns that we have, and that the communities that work in HIV, TB, malaria, is that we need to make sure that we can continue to deliver on our results, not necessarily because COVID-19 takes on a life of its own, but because we want to make sure that we don't backtrack from where we are in achieving these results and the impact that this can have. I mean, some of the studies that have been commissioned for TB was saying that we may be in a situation where our achievement of our targets will go back to 2013 levels. And so, that means a significant amount of years in backtracking and results. So how can we make sure that we can continue to respond to the needs of the communities, to ensure that people stay safe, because I think that's quite critical, but at the same time continue to be a voice for pushing to make sure that people continue to access treatment, that people continue to access testing, that people stay safe, that they have access to preventive measures, condoms, PrEP, so that we ensure that not only will COVID create critical issues within each country, but also that we can continue to make sure that we can deliver on our results.
Very important is opportunity for the Global Fund for the people. We have a comment from Anwar. I think that the community response to COVID-19 in the context of the Global Fund must to be documented.
Yeah, I agree. And that's what I was saying earlier in my presentation, Anwar, which is, I think that there will be a lot of lessons learned from really creative ways of continuing to deliver and to achieve results and to have an impact on the 3 diseases during this time. And I think that some of them will probably be areas that we'll think, why didn't we do this way before? So I see, for example, in some countries where, now we're finally able to push for multi-month dispensing, or where we have a situation where a country is or a subrecipient is trying to push for in-home testing. Or I was just seeing the other day an example from the Eastern Europe team, where they are able to now dispense different preventive measures, so PrEP and others, in pharmacies that they had been pushing for years that hadn't been able to be achieved before. And finally, they were able to do this through COVID-19 because there was no other mechanism for patients to access their drugs effectively. So I think that it's also an opportunity to see how we can, countries can become more flexible. I think the other opportunity that we have is that certainly health is on the agenda of everyone today, and the importance of strengthening our health systems. So how do we use this also as a platform, an advocacy platform, to say we need to invest more in health and make sure that our health systems are strong, so that, COVID-19 or HIV or TB or malaria continues to achieve the targets that we want, even within the context of and I think that the impact of weak health systems is being seen as a significant impact on how well countries can respond to COVID-19. And even countries that have fairly strong health systems are struggling. So and we still have a lot to learn. I mean, COVID-19 is still having an impact around the world. I mean, we don't know exactly how long this will continue to affect us. So there will be, as Anwar says, there will be a lot of lessons that we will have to document to all of this. And I'm sure we'll be working with you guys on the LAC platform to see how we can do this together.
Thank you for that. We have the last question, maybe. Yeah. It is possible that if the epidemic of COVID-19 remains for longer, it is one of the diseases to finance it independently? That is how a specific grant to finance?
Oof, that's a question that it's a very interesting question. I think that it's a question that a lot of people are having. I think that it certainly puts, as I said, a light on the need to continue to support and strengthen health systems. And we'll just have to see. I mean, nobody really knows what's going to happen, and how long this will last, and what is the legacy that it'll leave for us for the future. Nobody knows. I mean, let's reconvene in 6 months to 9 months and see where we are. Says the multi-country grant ALEP is planning to use part of savings to document community responses. Great. So we already have Carmen, who's one of our fund portfolio managers. Thank you, Carmen, who's saying that the part of what one of the regional grants is going to do is actually document some of these community responses to COVID. And I know other regions are doing something similar as well. So I think it would be great to be able to see how we can sort of set up a site or something where communities can just log in and see what is being done globally around, how communities are responding to this. It would be very interesting to see what we can do with this and how much it can grow, because I think it'll be really important.
Perfect. Great presentation, Annalise. Thank you so much.
Sure.
I don't know if you maybe have something also something odd. Or
no, I think okay just to close, I'd like to thank everybody for joining and for taking the time. Obviously, if you have any additional questions, please reach out to us. We're here to support you, and the only thing I'd say is be patient with our fund portfolio managers when you're asking questions, because they're being bombarded with millions of questions that they, have to also, this is all new to everyone, how the whole mechanisms, everything, the way it's working internally. So be patient with them. And if it would be great, I think one recommendation I could give to countries is that if you can consolidate your questions that you have and send them in one single group, it can be helpful versus each individual constituency sending us multiple questions that sometimes are the same. So collecting the questions through, for example, the CCM secretariats and sending them in a single sort of one go will be helpful so that we can also be more efficient and effective in responding to whatever questions you have.
Thank you so much again. And thank you all the people that participated today in the webinar. Remember, this webinar and other webinars are available in our YouTube channel. You can subscribe and follow us in social media, in Facebook and Twitter, Plataforma LAC, or visit plataformalac.org. Thank you, Annalise, and I hope to see you again soon.
Thank you. Bye-bye.
Thank you. Bye-bye.